Welcome to our discussion on the digital revolution that we're seeing in our health sector. The past 7 months have changed how we live, socialize, learn, train, work, and stay healthy. In the midst of myriad uncertainty and some considerable despair, there's some positive rays of life, light and hope. One of them just might be in our health sector. We've seen unprecedented speed by the Government of Canada to deliver services and programs to support the health and safety of Canadians. And we've seen unprecedented levels of collaboration and cooperation across jurisdictions, public and private sectors, and geographies, as health leaders have come together to stem the immediate impacts of COVID-19 and future-proof our health systems while encouraging economic recovery. We've heard, and some of us have experienced doing things in days and weeks that used to take months or even years. One example from this in my little corner of the COVID world is that at the end of March, our digital supercluster called on industry and public sector partners to come forward with ideas to address issues created or exacerbated by COVID-19. Within 12 weeks, we received over 700 submissions from industry and public sector consortia, with projects valued at over $1.4 billion for a $60 million program. We selected the top 34 submissions, and in the past few months, technologies have already been developed and deployed to help curb a host of impacts of COVID-19, to help keep us safe and to drive economic recovery. And so what can we do to harness the positives from these past 7 months and leverage it to build a more effective, sustainable, and agile healthcare system? Kind of a big question, isn't it? Lucky for us, we have 4 incredible healthcare leaders to help us answer that question. And our first leader to introduce our session is Dr. Stephen Lucas, Deputy Minister of Health for the Government of Canada. Appointed Deputy Minister of Health in 2019, Dr. Lucas has a long and extremely impressive history of commitment to public service across decades, including as Deputy Minister of Environment and Climate Change Canada, Senior Associate Deputy Minister in Climate Change, where he supported the development and adoption of the Pan-Canadian Framework on Clean Growth and Climate Change. Deputy Secretary to the Cabinet for Plans and Consultations and Intergovernmental Affairs at the Privy Council. Assistant Deputy Minister in Science Policy Integration at Natural Resources Canada, as we call it, NRCan, where he was responsible for the strategic policy development related to energy, mineral and forestry resources, climate change, and clean energy and international and government relations. Big topic. He was also with Health Products in the Food Branch, HBFB, at Health Canada, and a Senior Director at NRCan for Science, Innovation, Regional and Aboriginal Affairs, and a Director of Policy Planning and Coordination in the Earth Sciences sector. Let's face it, there's few spots of our public service that Dr. Lucas has not influenced, and we're indeed lucky to have such an accomplished leader and a dedicated professional in one of the most important positions for Canadians right now. Dr. Lucas, over to you for your opening comments.
Well, thanks so much, Sue, for that very kind introduction. And I'd like to thank the Toronto Global Forum for organizing this week's conference and our panel today on the digital health revolution. I'd also like to thank fellow panelists, Alexandra, Mike, and Luke, for their contributions to come and commitment to this effort. We started planning for this event with the Toronto Global Forum earlier this year, pre-pandemic. We didn't know at the time a virtual event will be taking place during the worst pandemic we've seen in our lifetimes. I think that's made the topic of today's discussion even more important because COVID-19 has pushed us to change the way we operate and to act faster than ever before, to harness digital and other innovative technologies and ways of working. And I think in particular, it's brought together industry and government, healthcare professionals, digital innovators, and many others that help across all the areas that we've had to respond to the pandemic, as you noted in the context of the digital supercluster, to pivot efforts and contribute to the response, working together across Canada. The overall theme of the conference, Forging a Resilient Economy, is a critical challenge for us all in the months ahead, and certainly a core area of focus for the Government of Canada, who recognize that Canadians need resilient health systems. And in this context, I think we all recognize that resilient health systems and a resilient economy do need to go hand in hand. So against the backdrop of these intertwined objectives, what I'd like to touch on briefly in my opening remarks are four themes. First is the critical importance of collection, access, and use of health data. It's been no more apparent than in the context of COVID-19, as the case data collected from individuals who've been tested has been central to the work of public health staff at the local, provincial, and national level to really better understand how to respond, both at the individual level in terms of care for individual patients, but at the population level and in our efforts to fight the spread of disease. We've advanced from the early days and recognized the critical importance of not only collecting first-order case data, but information on the demographics, socioeconomic status, ethnocultural and racial and indigeneity attributes of individuals in a way that protects their privacy, but helps provide a deeper insight in terms of how the disease is affecting different populations, and in particular, understanding the impact of health and social inequities on people, given what we know about how the epidemic has impacted racialized and lower socioeconomic populations in the country. I think as well, this has been an area where the Government of Canada, working with the provinces and territories, has worked to accelerate work through investment in data and information technology, working to a common national standard, as Chief Public Health Officers agreed, and supported through the Government of Canada's Safe Restart Agreement. Building on that, a second area I'll touch on briefly, and I think that will be raised in the context of our panel, is around virtual care. Prior to the pandemic, the vast majority of services, for example, in the primary care area, were delivered by face-to-face encounters. But by April, provinces and territories had put in place the infrastructure and implemented, for example, temporary billing codes, and close to 60% of the services were being delivered virtually. In facing the many, many challenges of the pandemic, we see this pivot to virtual care and improving access and enabling patient-centered care as a critical opportunity to be seized on. And I know provincial and territorial governments are focusing on this in a similar way. And whether that's enabling secure messaging and video conferencing to remote patient monitoring and enabling patients to have online access to their health information, including COVID test results. We did invest in supporting this endeavor with a $250 million investment in the spring to support provinces and territories, but also work on standards through Canada Health InfoWay. There is a series of complex policy issues to address going forward that we're working with provinces and territories on, including how to find the appropriate mix between virtual and face-to-face encounters, digital literacy, and supporting the change management for patients and providers in the context of provincial and territorial health systems. The third area I'll note briefly, and tied to virtual care, is the critical importance of continuing to support the digital health infrastructure in the countries. As provinces and territories look to build up their digital systems, it'll be important that the tools used now and those still to be developed can be integrated seamlessly. Canada Health InfoWay has been doing work on the key technical standards, for example, related to secure video conferencing and secure messaging in virtual visits. And I think having those standards also provides clarity and a level playing field for innovators, knowing the ground rules and enabling and supporting that innovation to deliver solutions. The fourth area, building on the theme of innovation that I'll touch on, is looking at how we extract further value from health data and information and apply new advances in how we extract that value, including through machine learning and the use of artificial intelligence. It can support better and more rapid diagnosis, research, and improving overall utilization of health system assets, as well as clinical care. And in this regard, Canada has supported the Canadian Institute for Advanced Research, who's been leading the Pan-Canadian AI strategy, and a key area of focus for them, and an area of recent work by a task force, is on artificial intelligence for health. So we think this represents an area to look forward to support and enable innovation and to try and extract more value from health information data to improve, at the end of the day, care and health system management. One of the points we could touch on later in the discussion is around how we can further strengthen that through having more open and innovative regulatory processes, including work we've done here at Health Canada to support the development of regulatory sandboxes. We did put some of that to practice in the context of the pandemic, including providing guidance to companies and working with manufacturers to support some of the critical needs on the side of personal protective equipment in terms of helping to define the regulatory needs and guidelines for manufacturing 3D printed personal protective equipment, including swabs and face shields. We see these agile approaches as, again, critical to helping to unleash and support the digital health revolution. So to conclude, we have seen the convergence of extraordinary effort across sectors in the context of the pandemic, public, private sectors, not-for-profit, and Canadians across the country. We certainly recognize the extraordinary efforts made by the private sector and the tireless work done by frontline healthcare workers. Through this digital technology, and more importantly, its use in terms of providing better care and information to act and take health decisions on, is a critical part of the path forward and an opportunity to build on. And so with that, we really look forward to hearing the perspectives of panelists and turn it back over to you, Sue. Thank you.
Thanks, Dr. Lucas. I don't think you've slept in the last 7 months by the sounds of things, and I think all of Canada owes you a debt of gratitude for keeping all of the balls in the air that you've just talked about, more importantly, driving us forward to solutions and doing things that perhaps 7 months ago we didn't think were possible in the health sector. And so having heard what's been going on in Health Canada and how the COVID pandemic has impacted Health Canada and indeed the Government of Canada, I'm going to ask the same question of each of our panelists. And I'm going to start off with Dr. Alexander Greenhill. And the question that each of our panelists is going to answer is, how has the pandemic impacted your organization, with a particular focus on digital technologies developed, deployed, adopted, or not adopted by your organization? So Dr. Greenhill is well known to many of us in the health sector. She's one of Canada's leading physicians in digital health innovation, in part through the development of the Care Team digital health platform, where Dr. Greenhill is the co-founder and CEO and Chief Medical Officer for Care Team. Care Team's developed a digital health platform focused on solving the fragmentation of healthcare, and it was the recipient of the Canadian Medical Association's Jewel Innovation Award. After having implemented health innovation at scale and practicing medicine across BC, Ontario, and Quebec, Alex now leads and advises Canada's most promising technology companies. Her work has received many recognitions, including Startup Canada's Women Entrepreneur of the Year Award, YWCA Women of Distinction Award, WXN's Top 100 Most Powerful Women in Canada, and the Business in Vancouver Top 40 Under 40, and the Queen Elizabeth Diamond Jubilee Medal of Service. Without further ado, Alex, over to you to answer the question of how COVID-19 pandemic has impacted your organization and the delivery of healthcare.
Thank you, Sue. And I think the comments to date were spot on. COVID revealed some of the issues that we've had, exacerbated others, and created new ones. And we were very lucky that the crisis struck now as opposed to 3 years ago, because we had more and better tools in place to address it. When we started out working with Care Team, it was the vision of a healthcare system that's centered around the patient, and where patients get care in many different organizations, but something needs to invisibly orchestrate that around them and make sense of it so that the best outcomes and experiences can be achieved. So in March, when COVID struck, that type of functionality became useful because we went invisible. We went to a model where patients shouldn't be seen in person unless they absolutely had to, and we had to make everything possible before and after that visit to make sure that all of these different actions taken make sense within the context of what's happening to the patient. And there were new requirements, and we were very lucky in Canada because both our provincial and federal governments actually listened to the experts. And so the clinical leaders who came together and said, this is what we need, the organizations in the community identified their needs, and then there was a rapid brokering of, okay, these are the needs identified, what can industry do? And so we jumped in as part of the effort to help, and we're part of several successful proposals, including one through the Digital Supercluster in Vancouver, focused on emergency care of elderly in the community, and one through the one in Montreal, the Scale AI, focused where we adapted technology that was made possible in trucking to dispatch people to locations and pick up packages. We literally overnight, 6 weeks later, developed an algorithm to match volunteers to do meal deliveries across the community so that the healthcare and social needs of people managed, all within technology that was adapted or created on the fly. I think that the comment about not sleeping applies to many people in this crisis. But the outcome is a modern technology solution that doesn't just deliver what is needed, but also gives data to the decision makers as to what's happening, what works, what doesn't work, and what else is needed.
Thanks, Alex. Yeah, we're going to come back to some of those things that you've talked about. Next, though, I am going to turn the microphone over to Mike Wessinger. Mike is the founder and CEO for Point Click Care, Canada's largest private software company and an industry-leading innovator in the effort to solve global challenges of seniors' healthcare, certainly a frontline issue for the past 7 months. Mike introduced the first cloud-based electronic health record, we call it EHR, in the long-term and post-acute care industry in 2000 by leveraging a software as a service, a SaaS model, and it's now the industry's standard software delivery model today. His forward-thinking vision to design the industry's first EHR solution allowed him to quickly become an instrumental force in changing the way healthcare providers leverage technology to deliver the highest quality of service at the lowest cost. Today, Point Click Care employs more than 1,500 employees and services more than 22,000 nursing facilities, senior living communities, and home health agencies across North America, certainly at the front line for the COVID pandemic and how we're attacking it. So, Mike, over to you in terms of how has the pandemic impacted Point Click Care and your delivery of healthcare to some of these most vulnerable people and communities in our society. Mike.
Yeah, thank you. And thank you for having me. I think one of the things that anytime you put a stressor on the system can start to accelerate the need for digital technology. So one of the very first things that we saw was they're really in our end market, which was really ground zero for COVID death and long-term care facilities, was really the need to capture more things digitally. This is an industry that has been a sort of a technology backwater among all other industries, and certainly within healthcare. So one of the first things that we did is we mobilized our team in order to create a standardized infection prevention and control application so we could capture data in a standardized way and understand what's going on with the pandemic, where there not only are problems, but where there are likely to be problems so you could forward deploy resources. But the other two things that we saw when stressors hit the system was the need to be touchless and to start engaging for telehealth and remote medicine, to be as touchless as possible, as well as to be able to engage the actual patients themselves and families and be able to do that in a remote way. So I think, the stressor that the pandemic put on the system really kind of drove these technologies. It's the type of thing that we likely wouldn't have seen for another 5 to 10 years. And I think as a result, we look at, as we look at retrospectives on what is that going to mean and what the technology is going to accelerate going forward. I think an increased digitization of health records. I also think interoperability so that you can do integrated care coordination independent of where the setting is for any patient, and in my case, for any senior. And then standardization so that you can make sense of the information you're collecting, and so that you can use technologies like artificial intelligence and machine learning to really get ahead of these problems.
Well, that's a long list, Mike, and we're going to come back to that in a moment. And I'm going to just put on the radar for all of you questions of interoperability increased care coordination, and why did it take a pandemic to drive us to do what we've done? But before going there, I'm going to turn the microphone over to Luc Villandré, President at TELUS Health and Payment Solutions, to answer the question from one of our largest private sector health providers, TELUS. Luc leads TELUS's TELUS Health, in its mission to deliver technologies that help connect doctors and healthcare practitioners to one another and to their patients by creating solutions that harness healthcare information and help transform our healthcare system and deliver better health outcomes to Canadians. Luc brings more than 30 years experience in IT sectors to his mandate with organizations such as Emergis, SHL Systems House, IST, and CGI. Luc is a graduate of the University of Sherbrooke, and when not helping transform our health system, he's committed to building stronger communities for those in need through his involvement as the president of the board of directors of the ALS Society for Quebec and a member of the board of directors de l'Avenue Hébergement Communautaire, a community shelter for young adults in difficulty. Certainly an accomplished leader and someone who has a pan-Canadian perspective on the delivery of health services across all of our provinces and multiple kinds of communities. Luc, over to you to answer the question of how has the pandemic impacted TELUS Health in your organization and in the delivery of healthcare. Luc.
Thanks, Sue, and thanks for inviting me today. The first thing I would go through in terms of the impact that we felt was a very high need for adaptability to adapt to this new situation. So to challenge ourselves on the traditional way of delivering services to our customer base and do it in another fashion. I think that, and I heard that through a couple of the remarks up to now, is that it of course was a great accelerator for change. Created a lot more proximity between the stakeholders into the ecosystem. And I would point out the great work of governments in there. I think I've never felt so much proximity with the health authorities as we did during this pandemic. So adaptation was number one. Two, I think it really was a call for innovation. Innovation in a fast-track mode because the high demand has been right there and rapidly growing, of course, with a situation that was not under our control. So here we're talking about adapting solution and bringing solution for the benefit of patients, healthcare professionals, and at the center of that, obviously, the virtualization of healthcare services and how we could deliver those. Point number three that I would highlight is we had to do this at scale. So time bounded in an environment that where the demand was right there, as I mentioned. So develop new modes of operations to either create those solutions in terms of the technology side of things, but also how we could scale into, I would say, a top operational experience for the customers. And in there, to illustrate, of course, we have a number of platforms, as you've mentioned, Sue, that we're delivering to the market, and we've seen tremendous growth. Either it's in the virtual care through the employer channel, where we've seen 300% growth compared to what we had in January. We've seen our physician and clinician switching almost instantly in a matter of weeks from a traditional vehicle of delivery to a virtual care platform and feeling, I would say, the value of it. But mostly, I would say to conclude that the patient has been, the beneficiary of those changes. And I would say we should take lessons out of, some of the things we've been doing in the last 8-9 months and apply that, into going forward to continue to transform the healthcare system for the best.
Thanks, Luc. Well, you've all raised some very interesting and provocative comments in response to that first question. The need to be touchless, the need to engage with patients and families. We talk a lot about patient-centered care. It's really been in the last 7 months we've seen it in action. the need to have interoperable systems and to have interconnected care coordination across multiple dynamics. And how come we were able to switch instantly? I think that was a term one of you used, and making sure that the patient is the beneficiary. These are all things we're going to come back to. I'm going to ask you questions about these, and let's just start off with Alex. One of the things that we hear a lot about is the role of the private sector in the health systems, whether it's in a provincial level, a community level, or pan-Canadian. And you've all experienced the dynamic between the public and the private sector health delivery systems. And so, Alex, first to you, and then Luke, and I'm going to ask you the same question. How can the private sector better contribute to strengthening the Canadian health system so that we're well equipped, not just to get through this phase of the pandemic, but future pandemics or crises that are going to impact our country? We know we're in the middle of one right now. Pretty sure it's not the last one. So, Alex, the role of the private sector in a publicly funded universal access system.
Well, it's always interesting to think about it because I did spend 20 years of my career on the public side before switching over to now do the kind of tools that we were lacking to execute the kind of visions and ambitions that we had. There needs to be a better collaboration because otherwise the innovators don't know what we need on the clinical side and vice versa, and the disconnect continues. So some of us need to cross-pollinate, but I like the comments that Luke did about proximity. I think that's been one of the huge advantages of this situation right now, and listening carefully to what people need, and how is it working after it's procured, after it's installed. How can you keep improving the tools that you are putting in place? The interesting question around private versus public is there's a tremendous amount of movement that normally occurs in sectors. And for various reasons, we've almost artificially sectored them off. And so when I switched over, there were comments like, oh, you've joined the dark side now. And you're like, no, I haven't changed. I'm still deeply committed to the public service. I just think that there's ways of moving that are more appropriate. And the structure of the mechanisms available to us in the private sector allows us to experiment and learn with things that the public sector can't do because they have a different mandate in a different context. And so I am very concerned about the multiple epidemics that we're now not paying attention to as much as we should. We had an opioid epidemic that was happening that's gotten worse since this pandemic. We had an obesity epidemic, and everyone jokes about the 19 pounds that they've put on since COVID stuck. But we have an anxiety epidemic. And so how can we start thinking about the tools that we're implementing right now to be useful for this current crisis, but useful beyond the current crisis? And that's in a dialogue that we've been having with our healthcare leaders. Luke mentioned health authorities, regional, provincial governments, federal governments. I'm really encouraged to hear that concern of give us tools that are not just COVID proof, but they are other infectious disease proof, but also allow us to manage the kind of patients who need to have care. And the 30% of drop of diagnosis of cancer that we experienced in March and April doesn't mean cancer suddenly disappeared. It just means we're catching it later than intended. And that will have dire consequences as well.
Thanks, Alex. So listening to what people need and evaluating how things are working. Dealing with this issue of the dark side. I've been on lots of panels over the last couple of months on health sector, and nearly every panel comments on the dark side, which for those in our audience who might not be in the health sector, when one moves from public delivery of health system or health services or a public organization into a private sector, especially an innovative organization like Care Team, one is quite often told they're moving to the dark side. Something we really need to address. And Mike, you've been in the delivery of healthcare to some of our most vulnerable populations as a private sector provider in public and private facilities, my guess is. So how do you see the private sector best contributing to strengthening Canada's health system so that we're well equipped, not just to move through the current pandemic, but for the future, especially with vulnerable populations like our seniors?
Yeah, thanks for the question. I think the combination of both is critical. I don't think the private sector or the public sector by themselves can really resolve the issue. I think when you look at the critical ingredients, at least in this pandemic, we know one of the critical ingredients was a crisis. There's nothing like a crisis to get people focused. But what it takes along with that is you need the private sector know-how. Take, for example, in the long-term care community, my entire adult life I've spent in this industry. Much of my team has. We're 25 years in this industry. We know it by the back of our hand. So, to be able to work with the public sector to bring our know-how and our decades of knowledge is critical. But there's a piece that we can't bring to it, and that is a mandate. And it's very difficult for a private company, to mandate things like interoperability and standardization. So we really need the public sector to be able to bring that, lend its weight to that to provide a solution, as well as in some cases funding. So I really think it's that combination of those ingredients that is required to truly innovate and be prepared for the future, whatever the next crisis or pandemic may be.
And so, Luke, I just want to bring you into this point as well. You've heard from two small companies, each of whom have their own history in terms of long-term care, in terms of CareTeam's digital platform. TELUS covers a broad spectrum of geographies, communities, technologies. One of the largest, maybe the largest private sector provider of health services in the country. And how do you see the private sector contributing to strengthening Canada's health system and future-proofing our systems so that we're ready to not just respond to, but to anticipate some of the issues that we can already see coming at us, as Alex has put on the radar: obesity, HIV is still with us, the opioid crisis, and one that we haven't talked about, which is mental health. So what's the role of a big organization like TELUS in future-proofing our health systems across Canada? Luke, over to you.
Thanks, Sue. Thanks for the question. First, I want to mention that I think I'm very much aligned with Alexandra and Mike on a lot of the way they read the situation. I think again from a TELUS perspective, and I would talk also generically, is that the private sector probably best contribution is to continue to push and bring digital innovations to the market. I think, and this is something where I'm going to talk a little bit about how we should interact with, public sector governments, but it is something I think that the public sector should steer and support, that the private sector will invest, will take risk, has, I would say, a mode of operation where there is agility, where there is pressure to bring those type of solutions out to the market. So I think that's the best contribution we can do. We look at virtual care, what the evolution that has taken place only in the last years is very impressive, and that needs to be done in supporting a massive patient influx. It has to be done at scale. I think sharing, the private sector best practice, also the learnings that we have in the different segments that we cover is very important. And you mentioned, sectors like mental health. I think connecting not only to organizations like TELUS, but to the employer market, who are experiencing, of course, first row, what mental health is all about with the employees that they serve. And thirdly, I would say, I think we mentioned work with governments in a way, and I like, Mike, what you said, like clearly define the mandates of government there, and help, I would say, to develop a cohesive vision and roadmap for the country. And again, into a competitive environment, of course. But I think that would be something that we would be looking for, normalization, standardization, and making sure that we don't go and build 10 different platforms for resolving the same problem or the same issue we have in the system.
So we've all talked now about the role of the private sector. And as we know, we talk about interoperability. We need to have an interoperable health system where the private sector and public sector need to work together. And Mike, I'm going to turn the microphone over to you to start us on a conversation about how can governments and health institutions and the private sector work together. So how do we all work together to pull digital and other innovations into the health system and really add value and better care, better outcomes, while also improving the sustainability of the health system? So we've heard about what the private sector does. Now tell us a little bit of your experience and your thoughts on how can we actually collaborate and work together across governments, public providers, as well as private organizations. Mike, over to you first, and then Deputy Lucas, I'm going to ask you to make a few comments on this after we hear from Alex as well. So, Mike.
Yeah, I think specifically as it relates to interoperability, the idea that we have very few connections between what may happen in ambulatory care, long-term and post-acute care settings, and hospitals is really a shame. It creates a lot of waste in the system, and I think this is not something that is ill understood by the private sector. We understand technically how to resolve this problem, but you do need governments to set and back standardization, to be able to create mandates, and in that sense, it can be a combination of sticking carrots, so some incentives for that interoperability, or penalties for the absence of that, and then I think and funding. It's solving the problem is non-trivial, but it's very solvable. But you need the funding standards and mandates in order to be able to make that happen. And those are the types of things that the private sector really needs to lean on the public sector for.
I'm going to turn the microphone over to you. And yesterday I was involved in a panel on this very topic, and there was a lot of comment about how physicians and perhaps pharmacists are still using fax machines, and the coordination between public providers and private providers happening through a fax machine sounds a little bit odd in 2020, especially in the midst of this pandemic. So, Alex, I know you've had lots of experience on both sides of that divide, if you will, as a practicing physician and as the co-founder and CEO of Care Team. So, how do governments and health institutions and the private sector, how can we work better together to pull some of these innovations in? And I'm going to take it a little further and say maybe change our culture.
Well, it's interesting because Mike is absolutely right. It's not a challenge of technology, it's a challenge of mindsets and rules. So the perception is that fax is the safest way of transmitting, even though when I send a fax, I actually don't know really who I'm sending it to. And if I make one digit mistake, it can end up in the wrong location. It is still considered to be the best practice. We've been able to replace fax digitally the last over a decade, but there are no clear rules around that being the standard, and therefore everyone defaults to what's already been in place and what they're used to. And it doesn't serve anyone because it's not a transmission that is digital. You can't pull data from the PDF, optically scan and translate, but the number of errors that can occur just increases. The rules that Health Canada put around AI were the first ones in the world around health AI and sort of regulating that space. And I think that type of regulatory assistance on privacy will be very key, especially we mentioned earlier engaging the patient, but also engaging the family. My patients don't get better until they have a support network around them, a team of people, either cheering them on or helping them practically with, appointments, scheduling. When you're sick, you're not well, you don't have a lot of energy. And so I'm sure that everyone in the audience has had a firsthand experience where either themselves or a loved one has been through the system. It's really, really hard to become the advocate for the person, even when the patient wants it. And so why don't we restructure some of our rules to enable patient consent so that with their implied or formal consent, information can be exchanged across systems, but they can also delegate consent to the loved ones that they choose to. advocate for them or be involved in their care, because 50% of our seniors don't have a family member within 100 kilometers. And under COVID, even if they did have a family member in town, they encouraged not to visit, not to participate or be involved because seniors are at high risk. So how and what can we quickly put in rules saying that patient consent is the driver, patients can authorize someone else to speak on their behalf or access the electronic tool so that they're not passing each other passwords on the phone to access their lab results online, and sort of streamline that and solve both the technical standards challenges but also the privacy standard challenges. And those are the kind of things that government can definitely help us with nationally, so that when you have a relative in a different province, you're not stuck dealing with a completely different set of rules.
Thanks, Alex. Deputy Lucas, I see that it looks like you're madly taking notes, or at least that's what I'm assuming you're doing. Taking down all of this sage advice from our private sector leaders. Couple of comments from you on what you've heard in terms of how governments and health institutions and the private sector can think about working better together so that we can deliver the kinds of services that we've heard Alex and Mike and Luke talk about, especially to our vulnerable population. So any thoughts from you on this before we turn to the next question?
Sure, perhaps a couple. I'd mentioned in my opening remarks, and it's been reinforced by Alexandra, Luke, and Mike, the critical importance of standards and interoperability. And again, doing it at a pan-Canadian level, which is one of the key roles of Canada Health Info or Canadian Institute for Health Information, just as kind of part of the backbone infrastructure, but as well critical to enabling innovation. But I'd like to kind of push it, beyond there. A critical point that have been raised is that collaboration, and we've been forced by a necessity to work much closer together at all levels, from local to national and international, as has been noted. And I think part of the reference frame is looking at broader care models and then understanding how digital health technology and contributions from the private sector, through procured services or technologies from government, or supporting employers and employees, can contribute. And I think that then forces the conversation, as has been noted, around what the experience means and how to optimize it for the patient and family, how to achieve better integrated care coordination rather than having our system work in silos between continuing care and primary care and acute, which is one of the challenges where health spending and poor health outcomes happens as a consequence of the lack of integration. The entire system, that's a pretty big ocean to boil, but there are critical areas that have come up, including for vulnerable patients, seniors in long-term care and home care, where we can and must do better. And I think bringing these elements together, as has been noted, is key. I'll just conclude in an experience we've had at Health Canada, where we moved from a role in policy and funding, in a sense, to operations. We saw a critical need as Canadians experience more anxiety and acute mental health challenges in the context of COVID, in helping build a new service called Wellness Together. But we enabled and brought together a consortium of health service providers and supporting technology to provide a portal to different services for frontline health workers, for youth and children, for people with more acute mental health needs through a portal. I know similar work is underway for both with employers for employees and through provincial health systems. But I note it because, again, there's a critical learning opportunity coming out of this about how we can see how these innovations and at some level experiments have contributed to better support and access for patients, and how the collaboration between the public and private sector can be harnessed, and as Luke had noted, bring some of these to scale and avoid the challenge of having multiple solutions at different levels of government or in different parts of the country. So I'll stop there, Sue.
Thanks, Dr. Lucas. I did say to our panel before we got going that our biggest challenge was going to be time, and we're into our last 4 minutes, and we've got two really important questions we want to address. So I'm going to go to one right away and give the microphone back to you, Dr. Lucas, because in your opening comments, and it's come up a couple of times in other comments, we've heard about regulation, standardization, regulation, and this concept of regulatory sandboxes. So, Dr. Lucas, how can stakeholders be engaged in advancing regulatory sandboxes, and what's the pathway to adoption to help spread and scale innovation that supports real health systems and healthcare? So quickly over to you, and then Luke, a comment from you, and then we're going to do our wrap.
So here at Health Canada, we've done 3 or 4 things in this area. One is recognize that digital health tools and solutions are health products themselves and need to be, properly supported in our regulatory framework. So we have a digital health team looking at both kind of static code and learning or machine learning type tools. So there is capability here to support companies. The second is we did change the Food and Drugs Act to enable advanced therapeutic products where we don't define a priori all the regulatory boundary conditions, if you will, and parameters, but design them and tailor them to the specific product or solution, which could include software. And that allows for innovative products to come forward, to learn from that experience, and then to move them over into more standardized regulatory frameworks, which allows for that spread and scale, but in a kind of adaptive learning way. And then the last part of the puzzle is we have put in place a dedicated concierge service for innovators to be able to move through the regulatory sandbox and look at advanced novel products and really, again, have an interactive experience to tailor those requirements around the product rather than forcing the products to be tailored into regulatory frameworks that were created pre-digital technology. I'll leave it at that.
And Luke, quick comments on the regulatory sandbox, which I'm sure TELUS has lots of experience with the regulations across our health system. So over to you for some quick comments on how we can be better engaged in the regulatory sandboxes as private sector participants.
Sure. I think Deputy Minister Lucas just brought a number of initiatives that are very positive and where we can leverage. I would add to that, let's reinforce the mechanism that are out there to share, to concert ourselves across the country, region to region. And I would say maybe, we need to stop to be a nation of pilots. I've seen so many pilots in the past 10, 12 years everywhere, a lot of money spent. But again, I use the word scale, but being able to define something within standards and normalization and then scale with it. So that would be the first thing. I think we also have to, we heard the word interoperability, really being able to leverage the asset we have. The rip and replace also has been something I've seen a lot in my last 10, 15 years in this business where sometimes we could leverage the asset we already have, but a very cohesive conversation between public sector and private sector here would help a lot.
Thanks, Luke. I'm getting the warning that we've got about 40 seconds left. So this is the challenge to my 4 colleagues here. In a very short snapper, you've got CEOs, policy leaders, health system experts from across the country listening to this. What's the one thing you want them to take away from your comments today? And Mike, I'm going to start with you. Very quickly, short snapper.
I think when you're looking for solutions, it's easy to find academics, but I think because academics spend a lot of time with the public sector and the private sector probably less so, that's not where they go to commercialize. So look for practical solutions. Don't go straight to the academics when you're looking to solve a problem. Not that there's anything wrong with academics. I think that's fine. But don't skip the practical solutions that the private sector can offer.
And Luke?
I would say for CEOs, I think transforming healthcare is the work of a generation. So we need commitment, investment, long-term. engagement. And maybe for policymakers, I would say try to resist being over-prescriptive, stay away of trying to solve the issue, but I would say support and enable the different stakeholders to get it done.
And Alex.
I'll try and answer the question you asked about how is now different than previous. Why are we moving forwards? I think we're leveraging what already exists. And if I can encourage everyone to stop reinventing the wheels or doing pilots or testing new ideas, but saying, okay, what have we already built that we know works? How can we collaborate and put it together? And this is the international forum. What can we give the world that we figured out, and what can we receive that we can implement here? It's time to collaborate because the challenges are bigger than our regions and nations. We need to band efforts together.
And final word to you, Deputy Lucas.
Well, my first word will be thank you to you, Sue, and Alexandra, Mike, and Luc for the contributions in the panel. And I just want to emphasize the critical importance of collaboration. I think we have an opportunity now to consolidate what we've learned and done and delivered in the past 7 or 8 months. And then how we, build it into the system and achieve scale and certainty, including through standards. So collaboration is going to be key going forward.
Well, thank you. Thank you, everyone. We've heard from some of our most committed, successful, I'll say smart, and dedicated health system leaders. We've heard about the importance of listening to what people need, engaging with patients and families. Evaluate how things are working and make them better. Don't rip and replace. Let's leverage the private sector's willingness to invest and to take risk. But don't try and boil the ocean. Let's focus on making things successful in small steps and then leverage and scale. Let's build digital health teams, and let's not be a nation of pilots. And the one thing I've heard most is let's work together. And I'll close with a proverb that we used in a former panel earlier this week. If you want to go fast, go alone. If you want to go far, go together. We have an opportunity now to leverage our willingness and the proof that we can do it. We can work together, small, large, innovative, academic, research, public and private sector, and deliver a better health system across Canada. Thank you, everyone. Thank you to the organizers. Special thank you to our panelists, and have a good rest of your day. Thank you very much.